More women die during childbirth in India than in any other country. A major new paper in the International Journal of Obstetrics and Gynaecology by Indian and Canadian researchers lays out the burden of maternal deaths in India, examining maternal mortality data from 1997 through 2020. According to the study, an estimated 1.3 million Indian women have died from maternal causes between 1997 and 2020. Although maternal mortality rates have fallen by 70% overall, the poorer states of India lag. One of the United Nations Sustainable Development Goals is a maternal mortality ratio below 70 maternal deaths per 100,000 live births by 2030. Meeting this goal requires understanding the current levels and trends in maternal mortality and the causes of these deaths at the national and subnational levels. India, like many countries with high maternal mortality, officially registers only a fraction of births, deaths, and vital events, and maternal deaths are concentrated in remote rural areas that are among the least likely to be recorded. To remedy the lack of information about the state of maternal mortality in India, the authors evaluated national and subnational levels and trends over a 20-year period using data from India's large ongoing mortality surveillance program, the Million Death Study. They focused particularly on the 9 poorer states of India with the highest rates and the slowest progress. The study divides the states into 2 categories: poorer states and other states. The poorer states comprise of Assam, Bihar, Chhattisgarh, Jharkhand, Madhya Pradesh, Odisha, Rajasthan, Uttarakhand, and Uttar Pradesh. The study sample included almost 10,000 maternal deaths among over 4 million live births reported in India through the sample registration system over more than 2 decades. Almost 70% of maternal deaths occurred among young women below 30 years old, with a peak at women in their early 20s. Nearly 2/3 of maternal deaths occurred in poorer states, with Uttar Pradesh, Uttarakhand contributing the highest, followed by Bihar and Jharkhand. The concentration of maternal deaths in poorer states was substantially higher than the proportion of total live births in these states. About 24,000 women died in childbirth in India in 2020, or more than 60 a day. But 2 decades ago, this was even worse, with over 100,000 women dying in 1997. Around 1997, in Rajasthan, about 1 in 3 of all deaths among women aged 15 to 49 were due to maternal causes. That proportion has fallen to 1 in 12. About half of the maternal deaths were caused by bleeding or obstetric hemorrhage, accounting for over 11,000 deaths in 2020 from this one cause alone. Bleeding or obstetric hemorrhage was the leading cause of maternal death in all states, but represented a notably higher proportion in Bihar, Uttar Pradesh, and Uttarakhand than in Maharashtra, Tamil Nadu, and Kerala, where the proportion of maternal deaths linked to hypertensive disorder was higher.
A 70% reduction of maternal deaths in India is a commendable achievement, which puts the country on track to achieve its 2030 goals of less than 70 maternal deaths per 100,000 live births. However, challenges remain, with still a significant proportion of maternal deaths occurring in health facilities, at homes, and in the poorer states of the country. Renewed efforts then are needed so that efforts can be directed towards improving access to healthcare, improving emergency obstetric services, and the treatment of pregnancy-related conditions like hypertensive disorders and infections.
This analysis provides the largest study yet to document trends in maternal mortality in India. It uses robust national data paired with geospatial analysis to show the marked variation in maternal death risk in the country. It demonstrates that the country must improve services in the poorer states if they are to achieve the 2030 UN goals. The study emphasizes the importance of continuing mortality surveillance to help identify gaps in the quality and coverage of interventions that can save the lives of Indian women. The purpose of counting the dead is to help the living lead healthier lives.